Hello everyone, I am Chen Mingjia. You can call me Zach. I'm very glad to be invited by Ray today to share with you some of my clinical cases that integrate digital technologies into dental treatment. Let me begin with a short self-introduction. I graduated from Poznan University of Medical Science in Poland and continue my specialty training and master degrees in Chai General Service Hospital in Taipei, Taiwan. I am a periodontist right now and run my own clinic. I'm passionate about digital technology and surgical innovation in dentistry. In my clinic, I continuously explore how digital systems can enhance patients' experience. I am also a 3D printing engineer, which gives me additional insight into digital workflows. I hope today's sharing will helpful and inspiring. My talk today is divided into two parts. First one is how facial scan systems assist our daily work in dentistry. And second part is from the face to function, digital integration in full mouth rehabilitation cases. In other words, the first part I will explain the fundamental of the technology and the clinical requirements behind it. And the second part will sharing real clinical applications. I also welcome your discussion and feedback, so let's begin. The dentist for me is just like a tool for exploring the world. It's full of creativity, possibility, communication, and the passion we feel when solving problems for our patients. With different kind of the technology, dentistry become more automated and precise, and evolution just keeping going. The digital world as a multi-dimensional network. It's not like the traditional traffic. You have to wait until the red light and also get stuck in the traffic. And you just can go anywhere, go to some direction because there are no connection. Instead, it's like a dense network floating freely in 3D space. As long as you connect it, your file can be accessed, shared, and used within the same digital environment. This allowed us to do things that traditional way could not, such as communication with the patient and our professional teams using more realistic 3D images instead of only text and photo. That's very powerful change. With the cloud platform and the digital software, we can integrate and share patients' information more efficiently even in different locations and time. It allowed us to gain a faster and more complete understanding of our patient's condition. A complete patient record including facial features and both soft and hard tissue information. We can quickly and accurately get the information we need and utilize the different specialty software to assist us to make the correct diagnosis, treatment sequence, and fully outcome product. And we can produce the precise, durable customer results. As we to gather this data, we relied on digital devices that must be clinical test or meet our clinical needs, or produce more compatible file formats so that we can share in each stage, from the beginning diagnosis to the final treatment, forms a seamless workflow. There are three key strengths of digital dentistry. First one is between patient and doctor. Because the visual tools help the patient understand their condition more faster, improving communication and trust. The second one is the doctor and the technician, because we can reduce the try and error and lower the appointment frequency. The third one is between the clinic and laboratory. The digital file removes geographic limits and allow remote collaboration and facilitate long-term record keeping. All that will be close linked, contribute to the entire whole treatment process. So why the facial scanning matters? Because we want to begin from the whole person. Dentistry is not limited to the oral cavity. Understanding the whole person allowed us to better understanding their functional and aesthetic desires.
I
Facial scanning
am
has advanced
metahuman.
rapidly in recent years, from Microsoft MetaHuman
that you'd
to mobile
expect in a
device
AAA game for a
comparable
digital
for
human,
producing 3D
making
models.
sure that anyone can use this
The
tool, that
technology
anyone can
is
create a
becoming
character in
commonplace
minutes or
and
hours that
deserve
used to
our
take
attention.
weeks and months.
That also
And
has
all
an
of that has to
impact
work at
on
that fidelity
dentistry.
with rigged and ready to.
Traditionally, we relied on 2D photograph for aesthetic planning. Until recently, this limitation made it difficult to establish a direct connection between photos and 3D design. Because photos lack 3D information and causing distortion, and also reducing the reliability of prosthetic design, we most seeking solutions. So we would like to have more 3D images to 3D intraoral scan. To actually rely the facial scan with our intraoral scan, we need to capture a clear 3D morphology of the anterior teeth. This allowed us to 3D to 3D matching, enabling technicians to design restoration correctly. And a smile facial scan can then be used to assess the visibility and the position of the anterior teeth and the occlusal plane. Further design the prosthetics for fabricate. Like that, we can use this information to make a digital web and to finally direct connect to the milling machine or the 3D printing. It's a seamless digital workflow. So we have to understanding the image principles and their limitations from the facial scan. Before using the facial scanners, we would like to know that they are generally fall into two categories. First one is the structural light type, and the second one is the photogrammetric type. The main difference between two types of the technology generally lies in following aspect. The structural light type, it has to have the active light projection to the patient, and generally is slower, and it can get much higher precision images. The photogrammetric type, they sometimes will need environment light dependent, but it can get the image faster, but usually it's more low precision and easily distortion. For example, this is the old type structural light systems like 3D morph require patient to remain still 1 to 2 minutes, and it needs strong light to project onto the patient's face. So you can see the patient needs to close eyes, and we need 1 or 2 minutes for that. And after that, you can see this is the image they required. The facial scan is really clear, but the patient's face is closed, his eyes is closed. So we try to use the handheld 3D scanner. This kind of the scanner, they don't project strong light to the patient, and they can connect to the phone. Then we can use handheld, we can get the facial scan. This is my clinical trial, and you can see we still need the patient to cooperate, the movement turn right and turn left, and then we have to hold the device stably, and sometimes the image just can't get to merge. And we also require the suitable environment light setting before use. That means it requires some preparation. So using this device, we need 15 to 20 minutes and we need hand-on experience. For busy daily practice, some things are not very practical. Yes, we can get the facial image, but we are not very convenient. So I tried to use the Rayface first generation. It was a purely photogrammetric basis. I capture image quickly with already setting. It works like an automatic device that is always ready to go. But when the image enlarged, I see the most critical area. The teeth was distorted and unclear. This made me disappointed, and we need more accurate information for alignment with the intraoral scan. So for my experience, I summarized the key requirements for the dental facial scanner. First one, we need choose part more precision. Second one, we need to let the device take the image more short time. Third one, we need more simple interface that everybody and also the dental assistants can be able to operate without much operation experience. And the fourth one is we need to support multiple file format. And the fifth one is stable and repeatable image is unaffected by the environment. So in 2023, the RayFace released the second generation, and which immediately get my attention. And after my testing, I discovered something interesting. First one, RayFace 2 has a hybrid system. Inside is a structured line near the oral region, and also the photomagraphy for the rest of the face. And you can see in the RayFace 2 scan, this is me, I remove my facial skin layer, and only the teeth are rendered with high precision, while the rest of the facial surface are captured using fast photogrammetric imaging. I think this selective hybrid design is likely the reason why the device can both fast and clinically precise at the same time, because the anterior teeth are captured with the high precision, so we can use it to merge the intraoral scans. In my experience, I think RayFace 2 has achieved this balance. Here is the comparison with this facial scan device I tried. It's hard to achieve both precision and convenience. Now, in the second part of today's lecture, I will share full mouth rehabilitation cases that I try to use the RayFace 2 integrated digital workflow. The first case is a simple overdenture case. I'm using the patient's existing dentures as an aesthetic reference to redesign and the surgical guide and complete the final overdenture. Here is the patient. A 79-year-old man comes with his son. His main concern is that his maxillary complete denture keeps falling out and makes it difficult for him to eat. He hopes to fix this so he can eat comfortably again. The primary examination, I think the patient generally healthy is good, and he is a non-smoker. His maxilla alveolar bone condition good, and with only few retained roots. The mandible is a full archifix prosthesis. This is his panoramic film. We can see the alveolar bone is quiet enough and good. Here is in oral condition, and also the maxillary alveolar bone. The initial evaluation and the treatment, we provide the oral hygiene instruction to the patient and the basic periodontal therapy for infection control during the first and second visits. And we ask the patient to take the blood test to confirm his overall healthy condition and confirm he is good and suitable for the implant surgery. And we confirm the patient's willingness and preference. Also, he is supported by his family. So after we explanation the possible options, generally fixed or the removable one, the patient chose the full implant supported overdenture. So that means we have to implant 4 implants on the alveolar ridge to support the overdenture. So how can we do? The first step, I rebase the original denture to improve its stability, because we need this as a reference to connect to different kind of information. So we use the flowable resin, which is radio opaque and I apply the spots on the CD surface and taking a separate CT scan for it. And then we ask the patient to wear this denture to taking the CBCT and also the facial scan. So after the data collection, and we can superimpose all of this information in the space. So we got the virtual patients. And use the facial scan, we can verify the anterior teeth display and check his old denture's tooth arrangement is suitable for him or need to be adjusted. And you can see this 3D virtual image after the patient leave. We still can discuss this image with our different treatment partners, also technician. And we also use different facial scan to capture his different face expression. So we can very precise to determine their anterior teeth position. So the next step, we take the advantage of digital technology. We make good use of copying, transferring, and reproduction of his old denture. Here is his old denture. We use it to superimposing the combing CT and also the intra-scan of his soft tissue surface and also the CD scan too. And then we're using 3D cross-section to plan the optimal implant position. And we can get the ideal implant position for the overdenture. And we make sure that is enough space for making this new overdenture. And also a best situation for the position for the implants. And we can use the digital file to verification of the implant position and their drilling tube openings on the complete denture. And after that, determination of the fixation pin. And I'm using this old complete denture shape as a template to create a surgical guide. Then I directly print it out using the desktop 3D printers in my office. And here is the trying guide in patient's mouth. With the occlusion and the soft tissue surface, it gets stably. And we use this guide first to fix the guide with the pins and perform the guide surgery in a very traumatic way. And this is just right after the surgery. And it's the panoramic we see. That after 1 week, we remove the sutures, the wound looks healing quite well. And we want to give patient some occlusal functions, even it's mild. So we trim his old denture. And I use the reline his old denture with the soft liner material. And then I got a new interim denture. Now everything is fine, patient is under the healing period, but I'm thinking, can I reduce the numbers of the rest appointments? Because if I use in traditional way, I have to take in impression, then make the wax ring and also check the wax tooth arrangement, and after I send back to the lab and they finally they produce the complete denture for me. So I think if I can transfer the interim denture to a recording base and take the final impression to get enough information, I just can go directly to make final overdenture. So how can I do? First, I duplicate the interim denture as a reference, use it to design by digitally a new denture. Then I print this digital denture as a recording base. I call back the patient and try in this recording base, and I check for his aesthetic and also the teeth arrangements, the midline and the occlusal plane. and also his face suitable this tooth shape or not. And I use this as a recording base to take the final impression and also take the bite. After complete this, we expect that the new removable denture can be delivered at the next visit. And I use the full digital denture workflow using the one-piece milling for finish this product. And you can see this is the milling video for these digital files. We are not back to the traditional way, but directly to milling out this complete denture. Here is the final product, primary, and the lateral side. And I also changed to the attachment abutment for the patient. And I pick up this overdenture for the patient on the O-ring system. And here is the connection. To enhance the color, I also use the stain to change the denture's color. I assist from our technician. And here is the final work. And also we can enhance the textures on the denture. Then here is the try-in visit. Patient wear this over denture very naturally. And I'm asking the patient to do some functional tests and also asking how his experience after using this over denture. The patient said he can eat food very naturally, both side, posterior and anterior side. He is very happy with this new overdenture. And now he can enjoy his meal without any worry. So this case, we show using the seamless digital workflow to efficiently reduce the number of appointments and deliver a satisfactory treatment outcome for the patient. The case 2 is about a complete full mouth rehabilitation case. Here is a woman, a daughter brought her mother to here. She is 76 years old and hoping to improve her difficulty with eating. And she had a previous treatment at the hospital and with the poor function used her old removable denture. And she wants to preserve her teeth as much as possible, but also restore the function and is unsure about the best approach. So she is not want to seeking for the treatment. After the primary evaluation, the first visit, she is generally healthy, only smoked 10 cigarettes a day for 10 years. And she used the temporary removable denture, both upper and lower. And her lower arch prone to movement, many teeth are mobile. And her midline is deviation and occlusal plane tilt. Also, she got the diastema. Here is her old temporary denture. You can see it's damaged in many places. And here is her initial panel. You can see she got a severe periodontitis and also lost a lot of teeth. And her intraoral conditions, the gingival condition does not like healthy and teeth shows pathological migrations. And many calculus and recession we observe and also mobile. So after several visits during the previous month, we provide her oral hygiene extraction and periodontal baxial therapy for preserving rest teeth. And we know more about her life and try to let her reducing smoking. After treatment, the mobility of the teeth has improved. Only we still need to extraction 2 premolars lower due to the intracanal caries and is hopeless. So we need to extract it. Then we correct the patient's data, and we also take the facial scan. First one, we got her smile and profile, and we know the anterior tooth is not clear and distort. So we have to take the other facial scan. using the retractor to expose more anterior teeth in order to merge with the intraoral scan. Here is her retractor facial scan. And also the intraoral scan can be superimposed to these anterior teeth. Then here is all the information are gathered together. Then here is a virtual patient and her bone condition and also with her teeth in 3D presentation. And then we can start the 3D digital smile design. First, we can use the software there inside will automatically to find the point, the marker, for us to be a reference to have the occlusal plane. As the usual way, we use the Facebook and traditional way, but now we use it totally in digital way. And after that, we can start to choose the template for the patient. We can find the color and different morphology for her, and also discussion with the patient and know what she is desired. Okay, after that, we made the similar, the final template to approximately to get her reach. Here is the 3D DSD before and after results. Then we export all this data to our dental technician. Then this software can connect to the ESOCAD system, also 3Shape and Blue Sky Plan. Each software, they have their specialty for what we need to do. So after the discussion with our treatment team, our the primary treatment plan will give her a free tooth bridge at the upper and also both and lower with the removable partial denture. And if she alone, we can use the one more implants, each for posterior side. So after we send this information to the technician, and he told us that this woman's midline deviation and maxillary occlusal plane require re-establishing. So we need to identify the source of the maxillary asymmetry. So we made the digital vessel first. Here is the technician software. Then you can see this information together to the technician. And he starts to do the smile analysis. Here is, he told us that the patient asymmetry not only for the right side missing, but also the left side is also too long. So that's why she looks very asymmetry. And we also can use this image. It's very realistic and let us to know more about the real situation. We can use the transparent layer to discuss with the technician and the other specialty. And here is her 3D DSD result, extraorally and intraorally. Then, with these digital tools, communication between the dentist and the technician becomes more efficiently. You can see the real situation, the ideal tooth arrangement have a big difference. So we need to know how to fix it. We can see the position of the central incisor is far from the ideal aesthetic position. Even we use the cross-section view to evaluate the distance we can modify, we're still far away from the ideal aesthetics result. So we have to explain to the patient the situation. After we use the photograph for that, and the patient understand the difficulty. So finally, she agreed to the extraction of the tooth in her central incisor. So I modify our treatment plan to the 4 bridge on the upper, and the other one is the same. This is as our plan. And here is the patient look like. And she is modified, mock-up, and she is very satisfactory to her aesthetic result, and looks very happy. And here is before and the after the treatment.
一直到牙齿有问题的，然后才。
The patient is satisfied with the result, and she told to her daughter that on the video call that she said she should have sought treatment earlier. So this case shows how digital visualization builds patient trust and provides significant benefit both dentists and technicians in achieving optimal results. And also the more complicated the case, the greater the uncertainty. Digital data integration and the record provide powerful support in managing these challenges. So the case 3 is the final case. It's an edentulous patient. You may also encounter situations like this. Patients seeking for the function and the aesthetics. But after the severe periodontitis, the tooth need be extracted, and that it becomes the edentulous case. So at a traditional way, you have to do the recording base and use the wax ring to take the wax bite and also to determine the central incisor or the canine or everything you need to have. It's just like this stuff. So usually we do on many appointments with the wax ring, but recently there is something new, the ray tray. I think its function is want to reduce the appointment between patients and us. So thinking about the traditional way, we have many steps to do. We have to take in the cast silicone impression, and also the individual tray and the wax ring, and also the tooth arrangement, and find the patient's profile and determine the VD, and also finally to get the final complete dentures. But if we can get the more information during the first visit, I mean, we can merge many different information we can get. Then we can get the printing temporary dentures in the second visit. So this is my trial. I use this ray tray to into the patient's mouth. And I just find the midline and the occlusal position to the patients. Should that it become a marker. And also take a bite. Then I ask the patient to take the facial scan for recording all the information. And here's also under trial and following, and we can get the temporary complete denture and totally digitally complete denture final results. The process is under testing, yet I think it's reasonable and promising approach. So in the future, I think complete digital information provides visualized treatment data. It significantly shortens the treatment time and improves the precision of the outcome. It's just like a building with the precision. Okay, thank you for your attention. Hope you can get some information during this lecture. Now, we got to see some questions online. We will answer, due to the time is limit, we will answer 3 questions, and the rest question will correct by Ray and will be answering elsewhere. Let me check online response. Okay, Someone told I think the face scanner is mostly for consultation purpose. But what kind of treatment do you perform a lot of purpose? Oh, okay. I think the consultation is only one use. We can use it in many space, many aspects. Like I will send the facial scan together with the intraoral scan routine taken and send it to the technician. So my technician will get the facial scan and intraoral scan. Then he can do the anterior aesthetics position at first, then we'll discuss later. And also, I think facial scan is important for the patient's profile on the lateral side because in the traditional way, we use the 2D photos to be a reference, but it's like the lateral side, so their product or their prosthetic treatment will somewhere is not so fit in our clinical view. What do you consider to be the main advantage choosing ray face over the other scanner? Okay, I choose the ray face because before I use them, I try a lot of different facial scan, and not only for the dental field, but also the other specialty. So I use them to try how can I get the facial scan for dental use. But as I mentioned earlier, most of them, they have two technique limits. They need the active project light on the patient's face. The other one, they need patient's cooperation. Then we can get the facial scan. But in our clinic, it's really busy and nobody can have enough time to do all these settings. So I would like for one all-in-one, and they can put on somewhere, and I just ask patient to go there and take the photo, then they can home. So finally, I try the ray face. What do you think is the biggest advantage of digital ray face? Okay, I just answered. From your experience, how do patients react before and after seeing their facial scan? Is there notable difference in their engagement? Okay, I think it's quite an important question. Because some of them, they use the 2D photos before and after to the patient. And I think it's very workable for the aesthetic patient. But in the full mouth rehabilitation case, they mostly want to know how their functions will be. So in the ray face, you can get the 3D images with them. They can see their in computer screen, and you can use your control to move the 3D image to let them know what's your plan for the posterior tooth, and also connect to the surgery and the implant, and also the processes in the future. So not only for the aesthetic, but also the function. I think the patient is very impressive after we explain this complete process to them. So I think it increased my patient's understanding. Just like my second case, the woman is denied to extraction any tooth, but after she got the aesthetic rebuilding and she agreed to extract the first incisor teeth, it's not important, it's not very easy to her. Okay, the other question for experience, how do patient, okay, I already answered. Okay, I think we all answer all these questions. If you have still any question, please direct contact me. Okay, thank you. This is my today's sharing. Thank you very much. Bye.